Thank you very much for joining the American Association of Kidney Patients and George Washington University School of Medicine and Health Sciences for this, our third annual Global Summit on Kidney Disease Innovations. The engagement of this audience worldwide is fundamentally important to the success not only of our future summits, but more importantly, to patients who are suffering from kidney diseases. Around the world, the cost and the burden of kidney disease is increasing, and it's been accelerated by the pandemic of COVID-19. Medical professionals around the world are under tremendous pressure. Researchers are under tremendous pressure. Everyone is racing for solutions, not simply for the immediate and the short term of COVID-19, but for the long-term implications, including implications for kidneys. This additional burden on kidneys worldwide and on patients is on top of a growing epidemic of kidney diseases. What's going to solve this problem? To put it really bluntly, it's going to take all oars in the water, pulling as hard as possible. But one of the strongest forces in that equation is the voice of patients and the energy that we bring to helping solve problems, not simply for ourselves, but for those who have yet to be diagnosed, and that's what this is all about. Patients around the world working as patient consumers who are informed about the science of their disease, about the implications for their families, have a very unique role to play. Our voice is the voice that must be heard by regulators in government, payers, whether they're in the private sector or the government, and they must be heard by those who are struggling every single day to try to bring treatments to us. Our voice needs to back up and be an advocate for the medical professionals, the researchers, the young scientists, those who are thinking about getting into this space, and most importantly, those of us who know, who can have an impact on kidney disease. We must be a voice for patients that don't have the energy and may not have the knowledge or the technology to speak up to their governments. Together worldwide, we can make an impact. Let me give you some examples here in the United States, just in the past 10 years, what an organized group of patients has been able to do, working in collaboration with medical professionals. In less than 10 years, we've been able to make HIV to HIV organ transplants possible, so those who are suffering from HIV can have life-saving kidney transplants. We changed the law. We've been able to get immunosuppressive drug coverage for the life of the transplant. Just in the past year, that was a 20-year fight, but kidney patients made that happen working with their elected professionals. And kidney patients worked diligently with labor leaders and the U.S. Department of Labor to make certain that the Family Medical Leave Act was interpreted and extended to those individuals who are called to be living organ donors, the selfless heroes that donate their organs and their kidneys to keep patients alive. Right now, we're fighting in the U.S. Congress to make certain that all kidney donors, all living kidney donors, whether they're insured or not insured, are provided with the protections of law here in the United States to make certain they're not discriminated against in life insurance, disability insurance, and health insurance. It's a proud battle, and we're going to win it. These are just a few of the examples of what we've been able to achieve here in the United States, working as a united front of patients with other stakeholders in the kidney community. We are absolutely convinced, as you've heard from our European partners in our European kidney allied patient groups and other patient groups around the world, we are convinced that we can help drive solutions and get those solutions into the hands of medical practitioners and patients so we can save more lives, prevent more disease, and allow people to pursue their aspirations and their goals across the globe in whatever country they live in. We know that the patient voice can have an impact because it has. We know the patient voice will have an even greater impact because we're getting organized, we're using better technologies, and we have a better sense of ourselves of what we can achieve. And for the patients that are listening that haven't had a chance to get engaged yet in clinical trials and research, understand this, that the research community worldwide and the medical community worldwide, they need us. They need us right next to them. And the dynamic of viewing patients somehow as no longer having importance or the same importance or voice, that's falling away. And what's emerging is a greater sense and appreciation for patient insights, and the value that we have and our life experiences have. I ask you to join us at the American Association of Kidney Patients as we build a worldwide consortium of patients. We're driving for a lot of things. We are going to get artificial, wearable, and implantable kidneys within the next 10 years. It's one of the reasons why the American Association of Kidney Patients started the Decade of the Kidney. We declared it so in 2019, and we've dedicated ourselves by 2030 to working around the globe with researchers and medical professionals and fellow patients to make certain that we can make that happen. We're in the business of saving lives, of inspiring other people, and making certain our voice counts. Your voice counts too. Whether you're a patient or a caregiver or a family member, I encourage you, join us. It takes all oars in the water pulling in the same direction, but the greatest power in that boat is the voice of the patient and the example of the patient.